What's up, ladies and gentlemen? Welcome back to Neurosketch with Dr. Kenny. But if this is the first time you've seen this channel, don't forget to subscribe. Today we're going to talk about popliteal fossa, and popliteal fossa is this diamond-shaped depression on the posterior surface of the knee joint. This is the knee joint, and posterior we have a fat-filled diamond depression, which is called the popliteal fossa. You cannot see it clearly here because it's covered by skin, superficial fascia, and the deep fascia. Skin, superficial fascia, which is also called subcutaneous fascia, and the deep fascia. And allow me to remove the skin to show you what I mean. Okay, on removing the skin, you can see this greenish depression here, which is diamond shaped, and this is what is called as the popliteal fossa. Okay, now we have said the popliteal fossa is covered by skin, followed by subcutaneous fascia, followed by deep fascia. The deep fascia of the popliteal region is called popliteal fascia. Popliteal fascia, this greenish as well, is shiny greenish. Let me show you. This shiny greenish here is called the popliteal fascia, and this is the deep fascia of the popliteal region. The deep fascia of the popliteal region, called popliteal fascia, is continuous with the deep fascia of the thigh and the deep fascia of the leg. This is the deep fascia of the thigh, and remember the deep fascia of the thigh is called fascia lata. So it's continuous with the fascia lata above and the deep fascia of the leg. The deep fascia of the leg is called crural fascia. Okay, crural fascia. It's continuous both fascia lata and crural fascia. Let me remove this fascia to see clearly we have muscles. And the very first thing that we're going to discuss today is the boundaries of the popliteal fossa. The boundaries of the popliteal fossa are very easy, and they are also kind of exam material. Okay, so it's easy. Write down the popliteal fossa is bordered by the hamstring muscle and gastrocnemius muscle. Remember, it's a diamond shaped, formed by the hamstring muscle above, superior, and inferior by gastrocnemius muscle. But we want to be specific as possible. So what are the superior borders of the popliteal fossa? Superolaterally, superomedially, inferiolaterally. Superolaterally, you have the tendon of biceps femoris. So the biceps femoris is forming the lateral boundary, especially the long head of the biceps femoris. Superolateral boundary. On the superomedial ones, you have the semimembranosus and semitendinosus as part of the hamstring muscles. Semitendinosus and semimembranosus. And then inferior, we've said we have the gastrocnemius. Remember, the gastrocnemius muscle has got two heads of origins. It has got the medial head and the lateral head. Now, the medial head is forming the inferior medial boundary of the popliteal fossa, and the lateral head is forming the inferolateral boundary of the popliteal fossa. Okay, next, let's talk about the roof. The roof, we have said, is formed by the skin, superficial, and the deep fascia of the thigh, also called the popliteal fascia. But the floor is formed by the lower surface of the femur, the joint capsule, and also a muscle which is called popliteus muscle. Three main things: the inferior surface or the popliteal surface of the femur, the joint capsule, and a muscle called popliteus muscle. We're going to see popliteus muscle. Alright, next let's talk about contents, and by far contents are very important as far as your exam is concerned. Contents. What are the contents of the popliteal fossa? Now I want you to write down from superficial to deep. You have nerve, followed by vein, followed by artery. Nerve, vein, artery, and other structures are lymphatics, and of course the muscle. We're going to discuss about all of these structures. Okay, one more time. What are the main contents of the popliteal fossa? You have vein, nerve, which is very superficial, followed, you can see, very superficial, followed by a vein, intermediate, and the most deep one is an artery. Let's start with the nerve. The main nerve that is very important at this region is called the sciatic nerve. I'm sure you remember the sciatic nerve, and I will say sciatic nerve is usually a single nerve wrapped. It's usually two nerves that are wrapped together by fascia, and that's the tibial nerve and the common peroneal nerve. And I want you to write this down. The sciatic nerve, it bifurcates at the superior apex of the popliteal fossa. Let me show you. This, you say, it's a diamond shaped. It has got superior apex and inferior apex. Now, at the superior apex of the popliteal fossa is where we have bifurcation of the sciatic nerve into common peroneal nerve and the tibial nerve. Allow me to remove this muscle, which is biceps, long head of biceps femoris, and you can see this is sciatic nerve. It bifurcates into tibial nerve and the common peroneal nerve. Now the common peroneal nerve, it runs on the medial margin or medial surface of the long head of biceps femoris. This is why it is not usually seen as waves. Okay, this is why it is not seen. Let me show you. Here. You see, you cannot see that common peroneal nerve from this view because it's running on the medial margin of the biceps femoris. Now allow me to remove again biceps femoris to show you the common peroneal nerve. This one, common peroneal nerve. Okay, next you have the tibial nerve, and remember the tibial nerve supplies a lot of muscles. All the muscles of the posterior compartment of the thigh, the hamstring muscles, are being supplied by the tibial branch of the sciatic nerve, with the exception of the short head of biceps femoris, which is receiving a nerve supply from the common peroneal nerve. That one, if you missed it, you can write it down right now. Okay, this is to say the tibial nerve, it has got muscular branches and cutaneous branches, because remember I told you all spinal nerves are mixed nerves. They have sensory and motor fibers within them. Okay, so this is the tibial nerve. Now, if I want to be very precise here, that we've said contents of the popliteal fossa are nerve, vein, artery, lymphatics, and of course muscle. But the most central, in the central compartment, the central bundle, we have specifically tibial nerve, we have popliteal vein and popliteal artery. These are forming the central compartment. You can see the common peroneal nerve is running on the lateral, is running to the lateral side. So it's not within the central compartment or central bundle of the popliteal contents. Okay, yeah, this is the tibial nerve. As I said, it has got a lot of muscular branches, supplies a lot of muscles here, but it also gives this skin nerve, which is called the medial surocutaneous nerve. Medial surocutaneous nerve is a branch of tibial nerve. You can write that down as well. Medial surocutaneous nerve is a branch of tibial nerve. But of course, we have the lateral sural nerve, which is a branch of the common peroneal nerve. Common peroneal nerve is also called common fibular nerve, and it gives this one. This is called the lateral surocutaneous nerve. The lateral surocutaneous nerve is a branch of common peroneal nerve or common fibular nerve, but the medial surocutaneous nerve is a branch of tibial nerve. Now, these two nerves, they're usually going to meet at a certain point, and this point of meeting is variable from individual to individual. It can be as high as at this region, but it can go as lower as the ankle joint. So it can unite at the ankle joint. Okay, but for example, see here. Yes, it's here. Yes. Okay, so you have contribution. This is the this one here. This nerve over here. Yes, this is a surocommunicating branch of common fibular nerve. It's going to communicate with the medial surocutaneous nerve, and together they are descending down as a sural nerve. This is very, very important, and I've told you this point of uniting is different from individual to individual. It can vary from upstairs there to downstairs here, as we have seen. But this is the other part. This is that other part of the surocutaneous nerve. You said the surocutaneous nerve is a branch of common fibular nerve, but these are the cutaneous. They are giving a skinny sensation, and of course this is giving sensation to the lateral surface of the leg. We're going to discuss about this at some point, but I want just to show you, I want just to be brief on how they are forming these two. They are forming this sural nerve, and this lateral surocutaneous nerve is going to give the communicating branch, which is going to communicate with the medial cutaneous sural nerve, which is a branch of the tibial nerve. Let me go back here. Okay. Also, Also, one among the very important thing to note, and you should write them down. Say this is a common fibular nerve, is a part of sciatic nerve, of course, but it enters in the lateral compartment. It is not within the central compartment of the popliteal region, popliteal fossa, and it's go to the lateral side. And this is very important. I want to show you here. It goes to the lateral side. It enters. This is the fibula bone, the head of fibula, and this common peroneal nerve is going to the neck of the fibula here. At the neck of the fibula, let me remove this muscle. Let me remove this muscle and show you what I mean here. Okay, at this point, the common peroneal nerve is very superficial at the level of neck of fibula. Let me zoom in. Let me zoom in one more time. Yes, at the level of neck of fibula, the common peroneal nerve is very superficial and it's vulnerable to injury. And the injury of common fibular nerve at this level, it will result into 40 drop. 40 drop. 40 drop is something similar as wrist drop because of inability of dorsiflexion. Okay, so you have 40 drop. We're going to discuss about it, but this is exam point. Most of the time they will ask you about the injury of common fibular nerve at the neck of the fibula. So if someone gets fracture of the neck of the fibula, you know what happens. Okay, injury to the common peroneal nerve, and injury to the common peroneal nerve will result into wrist drop, 40 drop. It is called common peroneal nerve or common fibular nerve because it's going to form two terminal branches, and we have the deep peroneal nerve or deep fibular nerve and superficial fibular nerve, and supplying different compartments. We're going to discuss about them and do an anatomy of the leg. Next, we have this vein here, which is called small saphenous vein. A small saphenous vein is going to empty blood into the deep peroneal vein, but it has to punch, it has to enter through the deep fascia of the popliteus, so it's called the popliteal fascia, to empty blood into the popliteal vein. And then one among other structures that I told you I will show you is this muscle, which is called the plantaris muscle. The plantaris muscle is also called, of course we're not discussing it here, but the plantaris muscle is also called I told some guys that this is considered as the Fleischmann nerve. Let me show you this one. Mona, this plantaris muscle is the muscle with the longest tendon. The muscle with the longest tendon in the human body is called the plantaris muscle, and you can see it has got a long tendon, and this tendon resembles a nerve. So some Fleischmann's first year student, they think this is the nerve, but in reality it's not a nerve, it is a tendon, but it's the longest tendon. This is why it's called Fleischmann nerve. This one, we're going to talk about it again when I discuss about anatomy of the leg. Okay, so it forms a part of content of popliteal fossa. And if I remove this muscle, you see we have another, that muscle that I told you I will show you, is called popliteus muscle. Is one among the floor of the popliteal fossa. Another nerve that I wanted to show you is this nerve, which is called the posterior cutaneous nerve of the thigh. We saw it at the gluteal region, posterior cutaneous nerve of the thigh. This is also not a content of the popliteal fossa, but it passes on the roof. You can see it's a little bit away. Let me show you. You see the contents. These are the contents of the popliteal fossa, but this one is very superficial. It does not get into the central compartment, and so a little bit like forming the roof of the popliteal fossa. Later, you're going to discuss about the genicular anastomosis. These branches of the lateral geniculate are whatever here. We're going to discuss them when I do an anatomy of the knee joint. This is anatomy of the popliteal fossa. And I think you have got something, and don't forget to subscribe, like, and share this video to your friends, and see you very soon.